4 exercises for Piriformis Syndrome with Dr. Noah Volz. Piriformis Syndrome is a painful condition, usually of the hip, because that's where the piriformis is located. Can sometimes be confused with SI joint pain and even like low back pain. So it can also be confused with sciatica because the sciatic nerve goes underneath the piriformis muscle. In some individuals it goes right through it, but for most of us it goes right underneath it. So there's quite a few possibilities when it comes to Piriformis Syndrome. This is more common in females, so let's get into it. So the 3 components of the Piriformis Syndrome are the sciatic nerve, the pelvis, and the piriformis muscle. So the sciatic nerve, as I mentioned, is basically a bundle of nerve fibers coming out of the low back and sacrum that travels down the leg and creates all of the muscle activity and sensory activity of the entire leg. And so most of the pain comes some sort of compression on that nerve. The pelvis, so the piriformis muscle comes off of the sacrum onto the leg bone or the femur. And so all of the muscles in this area kind of come off of the pelvis. So the pelvis is an important feature. The piriformis, this muscle itself. So that's mainly what we'll be focused on in order to get you out of pain. It's important to remember that pain is multifactorial. So although we think of it as a physical phenomenon, the piriformis muscle pressing on the sciatic nerve, there's so many other factors. Anybody who's been stressed out has noticed that they experience more pain when they have stress. And so there are these emotional, mental, and social factors of pain. It's uncommon to get any sort of imaging done when you have Piriformis Syndrome. It's usually used to rule out other conditions other than Piriformis Syndrome. But it's important to remember that most of us have some abnormalities when we get imaging findings. Any adult over 4 degenerative changes on x-rays, but these correlation between these imaging findings and clinical symptoms are poor. So plenty of people who do have these findings don't have any pain. So the orthopedic tests that are used to diagnose Piriformis Syndrome are the BD test, the FADIR test, the Freiberg sign, and the Piriformis sign. So that's what we'll use to diagnose this condition. So the 4 exercises for Piriformis Syndrome are the supine Piriformis Stretch, the seated Groin Stretch, the semi-stiff Deadlift, and the Posterior Lunge. So there's 5 key elements to doing these exercises. The first one is awareness. Stay present with what you're doing. Breathe, take full breaths as you move. Have full body engagement, even though we're focused on the low back and the hip. Feel your entire body all the way through. And you want to work hard, but not too hard. So effort, but don't overdo it. And be careful, but not too careful. So don't be afraid to do certain activities. So the Piriformis Stretch directions are to lay on your back and bring your feet in towards your buttocks, and then cross your right ankle over your left thigh just above the knee, and then bring that left knee up towards the shoulder, taking hold of the knee or the back of the knee, and then pressing gently here, keeping some engagement through that right leg as you press. Definitely want to do this on the side where you have pain, but you also want to do it on both sides for symmetry's sake. Next is the seated groin stretch. So you're in a seated position. You bring the soles of the feet together. You press the insides of the feet together and allow the knees to draw down. You can press a little bit with the elbows into the knees, but that's not necessary. The semi-stiff deadlift directions. So you can start to do this with weights and then with dumbbells or barbells. So you're in a standing position, you engage the core, you bend the knees slightly, and then you begin to hinge forward, coming down as low as is comfortable for you, trying to keep the back straight and the core engaged, and then coming back up. The backward lunge directions. So you're in a standing position with or without weights, and then you take the left leg and you step it back about 3 feet, lowering down onto that left knee, and then coming back up. Your standing position, stepping the right leg back 3 feet, lowering down towards the right knee, either touching or hovering just above the floor, and then stepping that foot forward. So those are the exercises used for this different condition. The benefit of working with somebody is that they can help guide you and find what's the exercise that's going to work best for you and make modifications to those exercises to either make them easier or more challenging. And so everybody is going to have a number of reps and sets that's going to be like the sweet spot for them, where they're using about 60 to 80% of they're working at 60 to 80% of their capacity. And so that's really what you want to try and find for you. So these exercises may be too easy, they may be too difficult. You're going to have to vary them and work with a number of reps and sets, so you really find that sweet spot where you'll get the most benefit. So my approach, when you come into the clinic, first we'll reset the system, so we'll break the pattern of pain. Then we'll reinforce what needs to be reinforced. As I mentioned before, there's other factors besides just the physical that may need some support in order for you to get out of pain permanently. And then we'll retrain the system, so retraining the body and the mind to increase stability and build strength. So hopefully these exercises work for you, and this can be enough for you to get out of pain. If they're not working within the first week, then you're going to want to schedule with somebody to get a second opinion so that you can figure out what's really going on and make sure that you're using the best strategy to get well soon. So thank you so much for watching. I look forward to seeing you in the clinic soon.